Being a doctor is fun, but it's not always easy. The problem for a doctor is to know when a symptom is a symptom. Especially when it comes to the lower urinary tract symptoms, most of these symptoms, they are kind of normal also. Take for example nocturia, a symptom that could be normal. For example, if you drink a lot of tea in the evening, or you go to the pub and drink a lot of drinks maybe, then you probably experience nocturia and probably has to go to the toilet a couple of times during that night. Therefore, it could be a normal symptom. Frequency during daytime is the same thing, depends on how much you drink. Or let's take some of the symptoms from the emptying phase of micturition. During the emptying, for example, starting up micturition could be problematic sometimes if you have had a lot to drink and you really feel urgency that you have to empty your bladder. Sometimes you might then experience that the bladder takes some time to start up micturition because it has been overloaded with volume. So even starting up problems and hesitancy can be normal as a weak stream, because when you have a very full bladder and start your micturition, the stream could be weak and the emptying phase could be pretty long. So these symptoms could be normal. How should you then behave and judge the patient's symptoms if they are pathological or not? Well, you have to listen to the patient, and if the patient feels bothered by their symptoms, then it is a symptom. And then it is something that you have to investigate and find out more about and maybe help the patient in some way. That is a symptom.